Hey there, and welcome to the latest episode of the Mind Body Health Podcast with myself, Dave Sheahan, dedicated now for over 25 years to educating, motivating, and I do truly hope inspiring you to evolve into the best version of yourself and to live your best life, because it's there for you. The power is there in our hands. And as we stress in this podcast all the time, it's about taking personal responsibility and doing what you can to move your life to where you want it to be and where it can be, because we have unlimited potential and we can be who we want to be. We can live the life we want, but we have to take action. It's about taking action. And as I said, educate, motivate, inspire. So it's a big part of education, which today's episode is going to be a huge part of. I'm delighted to have Dr. Nitu on from the UK, a highly regarded and respected obstetrician and gynaecologist, specialist in PCOS and periods and menopause, and author of Living PCOS Free. This is going to be a different kind of topic to what maybe we've done before, but it's one that's super, super important. And it's one I feel both men and women need to learn so much more about. And this is where, as I said, like education is key. So Dr. Nitu, thank you for your time. I know you live a very, very demanding life. So I'm delighted that you're taking time out to be on the Mind Body Health podcast.
Thank you. Yes, it's demanding, but thank you, Dave, for inviting me. Yes, my life is demanding, but in a nice way. There's nothing that I do that is painful or not pleasurable. So I wouldn't call it demanding in that way. Yes, it's demanding on my hours and my sleep in some ways, but I love what I do. So I'm so happy to be here. And hopefully everybody who's listening, as all genders, what I have to say doesn't only resonate with women. It's for everybody to take on board. And so I'm really happy to share whatever I know with you.
It's great having you here. And, it's like I said at the start, I touched on, and we spoke of just before we came on, this is a whole area that everyone needs to know more about. Like men in particular are very ignorant towards this. And
Yes.
Women, a lot of women are just uneducated towards it. Plus they feel they don't have any control. It is what it is. When, as you'll share throughout this interview, there's a lot that women can do to improve the situation and possibly even eliminate. Like we have the power to improve our situations in many ways, but especially in the pain that many women experience during period.
Yes. I just want to start off by saying that, first of all, when I refer to the word women, I also use those assigned female at birth. So not everybody identifies as a woman later on or right from the start. So it's important that we include everybody. But important to also understand is that surveys have shown that 1 in 4 women don't know where, for example, their vagina is. 1 in 2 women don't know where the neck of the womb or cervix is. 1 in 10 actually don't even know where the reproductive organs are. So it's really important for those who are listening to actually get to know your body better, get to understand how the male and female body works, the different organs. And so we have the uterus, which is the womb. And from that arises 2 beautiful, slender fallopian tubes with flower-shaped fimbrial ends at the end, which then help to move the egg, which is released from the egg baskets or the ovaries in the body. These sit very low inside the woman's pelvis in most situations, and the womb connects through the neck of the womb or the cervix into the vagina to the exterior, which is the vulval area, the outside part, which starts from the top or the mound of the pubis right down to the top of the back passage or anus. So it's really important to know these different words. What do you mean by vulva? What do you mean by vagina? What do you mean by cervix? What do you mean by uterus? What do you mean by ovaries or the fallopian tubes? Why? Because when you get to know your body better, what happens is you can then know when things are not right and actually explain it better, articulate it better to your health professional, to your doctor, so that you are not, because you only have 10-15 minutes. And when you sit in the doctor's chair, like I'm sitting in this podcast chair, you tend to forget things. And so what is useful to do is to actually write down your symptoms, write down what medical or surgical history you've had so far, so that you have all the information that is there. When did your periods first ever start? When was your last period? What are your periods like? What allergies do you have? What drugs are you on? What do you want out of the consultation? These things are so important, whether you're a man or a woman, having this information, because you get 10-15 minutes with your doctor. And if you don't have this information, you're sitting and thinking about, how are your bowel movements, or how many cigarettes you smoke, or how much of alcohol do you drink. What happens is you lose precious time. And so you want that information out there, and you want to understand how your body works. You don't have to be a scientist. You don't have to be a doctor. You don't have to be a health professional. All you want to know are the basics, which should really be taught in school properly, and then carried out through public health education. And the government has to take a lot of responsibility for it. But at the end of the day, as we spoke before, you as a person have responsibility, because nobody else loves your body as much as you do. Not your mother, not your father, not your partner. You are responsible for your body. And so you have to look after it with care. Talk to it like as if he or she or they were your best friend.
And your body talks back to you as well.
Yes,
that's
because if you
your body.
Stop and think and say to yourself, I'm ugly, or I'm not worth it, what happens is, would you talk like that to somebody that you really, really care for, whether it is your child or your best friend? Would you talk like that? If the answer is no, then don't talk to yourself like that. So that's what I would say. Self-care, before you do anything else, self-care and knowing your body are the two things that I want everybody to take away from this podcast. That's what you want to do, so that you can then take the next step forward.
Yeah, such important message, because each person needs to realize that they are the most important person in their life. And
Correct.
Too often that doesn't happen. And especially again with mothers in particular, we're probably the most guilty of that, where everyone else is the more important person.
Yes.
But we individually are the most important people in our lives. And the other thing, like you were saying there, in terms of just the basic knowledge of your body and body parts and different areas.
And that's what we do in our book as well, Dave, Living PCOS Free. What Rohini and I have done is we've got simple diagrams to try and explain to people, how their body looks and what to expect in their body. So just understanding that there are different parts of your body that you should be aware of. And the thing about mothers is that it's cultural, it's society, that women have always been told that to shrink themselves, to make themselves lesser, to make themselves smaller, and including mothers and anybody, grandmothers, mothers, women in general. So what happens is we've never taken our health into consideration, even though we have a whole specialty dedicated to women's health. So I ask my patients, why don't you talk about painful sex or urinary incontinence or vulval problems and things? They say, because doctor, we don't want to waste the doctor's time. We think our problem is not important enough. We thought that we will do it after, I have really heavy periods. I have patients on my street who have ended up in my hospital needing a blood transfusion because they've been having such heavy periods. And because they felt, I'll just wait for my son's GCSE to finish, for my daughter's, prom to be over, whatever, or, my daughter's A levels to be done. So when you do that, you put yourself back, and of course, then ill health may jump in and take decisions for you that you don't want those decisions, well before you've actually prevented it.
Yeah, like it'll always creep up, and your body speaks to you, and the body will only take so much, so it will always stop you eventually. So this is where again people need to start, learning
and
more, becoming more aware.
There's not a single health condition, not one, that does not benefit from bringing in lifestyle changes. The 6 lifestyle pillars. There's not a single general health condition, whether it is you're trying to prevent heart disease, whether you're trying to reduce your risk of cancer, whether you're trying to reduce your risk of getting high blood pressure, whatever your genetics may have thrown at you. There is not a single general health condition, type 2 diabetes, you name it, mental health, all these things, including women's health. There's not a women's health condition or reproductive health condition that does not benefit from actually working on these 6 lifestyle pillars. You may need medication at the same time. There's no medication shaming. I'm very clear that people need surgery in some situations. I'm a surgeon myself. I operate every week, several times. You may need medications for your blood pressure, for your diabetes, but that does not mean or you might need chemotherapy, radiotherapy, but whatever you do, lifestyle should be part and parcel of that education that we give to the person, and for you to take on board to see what changes can I bring in that can actually help me live the best life I can.
And this is what I love so much about what you do, is that you push so much the power of lifestyle and lifestyle changes, and especially in an industry that you're in where it's total flip. Lifestyle is often rarely regarded or even asked about by doctors.
That's because we're not taught, Dave.
Exactly.
We're not taught it. We're not taught it in medical school. So the doctors tend to get the same information where the public get it from tabloids and broadsheets and things like that, from the social media. And so they don't know exactly. So they feel hesitant. And often these doctors are also teaching nutritionists and dietitians. So again, that information is not necessarily robust enough. So what happens is, I'm not a cardiologist. So if somebody has a cardiac condition, I'm not going to try and treat it. So that's what I tell doctors as well. Find people who are actually interested in lifestyle medicine, who are interested in the lifestyle approaches. Educate yourself, but also don't feel bad to refer somebody to the right nutritionist, the right dietitian, the right doctor, so that they can look at this aspect. If you don't feel confident in addressing that, there are plenty of people around who can actually do that now.
Yeah, and I think that's a really important point, that people need to kind of leave the ego at home and refer when they need to refer to someone who is in a better position to help the client or the patient, to do that, because we all need to be in this together and help each other collectively.
The person is the most important. So rather than having this tussle between the wellness world where they say, don't take any medication, it's all dangerous, it's all poison, don't take hormone replacement therapy, don't take the contraceptive pill, don't take the diabetic medication, while the doctors on the other hand say, oh, lifestyle not that important, really just lead a healthy lifestyle, and the person goes away completely confused. So that's what I'm trying to do, is to bring those two worlds. It's not one or the other. They both should walk side by side. That's the definition of lifestyle medicine. It's not alternative medicine. It's not functional medicine. It is medicine that is evidence-based, therapeutic approaches to lifestyle that can actually help either on its own to prevent conditions, chronic conditions, and many women's health conditions, and also treat it, and in some situations put it into remission. We don't like to use the word reverse, because obviously if you go back to sleeping badly or stressing more or not exercising or not eating the foods that actually nourish you, or being lonely, then those conditions may all come back up again. So reversal is not a word I like using. I like to use the word remission, so you can put it and you can be in control. That's why our book is called Living PCOS Free. That means the polycystic ovary syndrome, the condition that affects, is the most common endocrine condition that affects women of the reproductive age group, is the most common hormonal condition that affects women. We say that, while you can't cure PCOS, there is so much you can do to control it. Polycystic ovary syndrome should not be controlling you. You should be controlling it. And there are so many ways of doing that.
Yeah. And Dr. Nitu, to clarify for people who maybe, again, a lot of people don't really understand the terms or what these things are, or even have ever heard of the words. Even for myself, it's only in the last couple of years I've become more and more aware of a lot of these things from people I know who have gone through immense pain pre-period and during period. So it's arose my curiosity. But like PCOS and how do you pronounce it again?
Endometriosis.
Endometriosis. There's adenomyosis as well.
Adenomyosis.
That's it. So
I can explain all those terms very simply for you.
If you do that, so people can understand better what they are as we discuss it.
So we'll start with periods, because it's really important to understand the menstrual cycle. Most young people who menstruate will start their periods by the age of 16. If after the age of 15, either if you're listening or if you have a child who has not started their period, you must take her to the doctor, even if it's just for reassurance, because it's important. So most people start anywhere between the ages of 8 and 16. The average age is about 12 to 13. And then you tend to stop your periods between the ages of 45 and 55, and that is the menopause. The average age is 51 all over the world, generally. So 51 for completely stopping your periods, when the number of eggs that you're born with in your ovaries drop, and so your hormone levels drop. And between the ages of 8 and 16, you start your periods. So there is this big group. Some people will stop their periods much earlier, and that is known as premature ovarian insufficiency. We're not talking about that today, but this is the general life cycle of the periods. Now, periods tend to be, when you menstruate every month, between 24 and 35 days is the normal duration or frequency of cycles. If you're missing periods, if you're having delayed periods, if your periods are coming every couple of months, every 3 months, and you're not approaching the menopause, or you don't have any other obvious cause, severe stress, or you're going through medications, one has to rule out conditions like polycystic ovary syndrome. So polycystic ovary syndrome, so periods, so we got it, 24 to 35 days, any bleeding more than 7 days, any bleeding that involves large clots the size of a 50 pence coin, or flooding, or you're leaking through your sanitary, through your period products. I don't like the word sanitary, actually, trying to get away from those words. From your menstrual or period products, what happens is that means that you're having heavy periods. So periods that last more than 7 days are associated with unusual amount of pain that affects the quality of your life. Remember, 2 weeks of a woman's life in a year is taken up with being unwell from periods. And that's a lot of work days that are lost. And if workplaces don't actually recognize that, that can be a real issue.
True.
Plus, you may be at work and actually can't focus because you're in that. And you're also, there's a stigma. So you're hiding and going with your tampon or your pad and things like that. So
that's a big thing, right, Dr. Nitu, that needs to change, the whole taboo and shame around this area.
Yes.
So this is why it's important to get this information out there.
Yes. And I encourage all the men listening, go out, buy the period products with your daughter or your partner, so that, people actually understand it's okay if you are that person who's actually talking about this freely. Encourage those discussions at home as well. And so periods should last, how light it is doesn't really matter, but shouldn't be more than 7 days. If it is more than 7 days, if it's heavy, if it's clots, if it's very painful, if you're needing to take a lot of medications, if it's affecting the quality of your life, then that needs attention. The cycle length is between 24 and 35 days. And so if this is out of the ordinary, then that needs attention. And because that could signify symptoms of conditions like endometriosis. Endometriosis is where the lining of the womb every month gets shed like a period. Tissue which is very similar to that lining gets stuck outside on your ovaries, those egg baskets I talked about, to the back of the womb, and can cause painful periods, pain on intercourse and on sex. It can cause chronic pelvic pain. It can cause nausea, vomiting. It can cause fertility issues and infertility, a lot of scarring and ovarian cysts. So endometriosis is a chronic condition. And I'll never forget this patient of mine who came and told me, Dr. Bajekal, I just wish people could see what pain I'm going through. Sometimes I feel my fate is worse than cancer or as bad as cancer because I look normal and nobody wants to empathize because they don't realize what a struggle it is with my chronic fatigue and my chronic pain. And I tell you this, I heard this 25 years ago, and that was one of the things that triggered me to start looking at patients more as people, as a whole person, rather than just a symptom to be managed. Condition that endometriosis I would do surgical treatment for. Of course they need that, but they also need everything else to be looked at. So
focus on cause, like a big focus on cause. Yeah,
correct. So endometriosis is a condition that's a painful condition. Usually it has several grades. Not everybody has pain, but heavy periods, painful periods, chronic pain, chronic fatigue, infertility, scarring, bowel symptoms, ovarian cysts, all these which contain dark blood because you bleed into the ovary, and is known as chocolate cysts because they do look like dark chocolate. So that is endometriosis. Polycystic ovary syndrome is the most common endocrine or hormonal disorder to affect women of reproductive age. So between the ages of, say, 8 or 10, up to menopause, with symptoms going into the menopause with womb cancer, increased risk, and type 2 diabetes and heart disease. But during, when you have, how do you think that you may have polycystic ovary syndrome? And we discussed that everything in the book, in Living PCOS Free, with the help of case studies, mythbusters, pointers, and talking less medical jargon. So if somebody is listening and they say, oh, I do have acne that is beyond my teenage years. So cystic acne, painful acne that is on your chin, on your jaw, on your neck, on your back, is a sign of excess amounts of androgen, which is one of the most common androgens we all have heard of, are testosterone. Testosterone is not a male hormone. Testosterone is present in all genders, men, women, children. It's just present in different amounts in different stages of your life. So your levels of testosterone will be very different from when you were a teenager, from when you're a 90-year-old man. Similarly, testosterone is very different in a menopausal woman from a woman who's actually in her teenage years or in the reproductive age group. So testosterone excess or androgen excess can cause symptoms of cystic acne or painful acne, nodular acne, and any acne that persists beyond the age of 25 has to be taken very seriously. Also, other signs of androgen excess, hair growth where you don't want it, on your chin, excess amount where you're having to remove it all the time, on your chest, on the inner sides of your thigh. Again, a sign that you may be battling with androgen excess. And female pattern hair loss, so hair loss from the top of your head. So these are the three constellation of symptoms that one of these, if you have, you might be thinking, oh, do I also miss my periods? Are my periods coming every 40 days, 45 days, 60 days? A combination of those two pretty much will tell you that you are having this condition of polycystic ovary syndrome. Some women will have one or the other, but you need two out of the three criteria. So you also sometimes would benefit from having an ultrasound scan, not for teenagers. Teenagers have to have those clinical symptoms, but either with the help of the ultrasound, you might see this little ring-like rosary appearance of these empty immature egg follicles. There are no cysts. So the word polycystic is a misnomer. So it's basically immature egg follicles that are sitting just below the surface of the ovary and are not growing to maturity. So the main reason why somebody is missing their periods in polycystic ovary syndrome is because they're not releasing an egg every month. So they have all these little follicles all racing to the surface to become the queen, but none of them are selected. So what happens is you basically have this condition where sometimes on the ultrasound, your ovaries appear enlarged or have this rosary appearance or pearl necklace-like appearance of these follicles. You may not have to have, you don't have to have that, but if you have that along with missed or delayed periods, then you have polycystic ovary syndrome. If you have acne and you have missed periods, you have most likely got polycystic ovary syndrome. It's a diagnosis of exclusion. So you do have to rule out ovarian tumors, adrenal gland tumors, and blood tests. Some blood tests we do to actually check what are the levels of testosterone, what are the levels of the protein that are released by your liver. So basically, it's a condition that is, the hallmarks tend to be period problems, missing periods, and signs of androgen excess. The interesting thing is you may also have men in your family who show characteristics of PCOS. How do we know that? So men listening to this may be thinking, wow, are you telling me I don't have ovaries? Well, polycystic ovary syndrome is not a disease of the ovaries. It just affects the function of the ovaries. It causes hormonal imbalance through insulin resistance, through the brain. So there's a big connection between the brain and the ovary, which we explain in as simple language as possible in the book. But what happens, so there's a big study in the UK, Dave, just come out from the Biobank Oxford study, 172,000 men, I think, or 175,000 men. And they found that men who have sisters and mothers who are carrying excess weight or have polycystic ovary syndrome symptoms may have increased signs of frontal balding. They may have excess high triglycerides on the blood test, the lipid levels, cholesterol, triglycerides. They may have increased waist circumference. They may have type 2 diabetes. So they show all the characteristics of PCOS. But of course, in PCOS, you have the metabolic symptoms, which are the signs of insulin resistance, where your body is become resistant to the action of insulin, the hormone produced by the pancreas, which helps to move glucose from your bloodstream that is broken down from the food that you eat, from the banana, from the potatoes, all the healthy foods that you eat. It has to be broken down to glucose. Why? Because our muscles, our liver, our brains, they all function on glucose. So it's really important for this insulin to do its action. But when that insulin receptor is either defective or it is blocked by fat, such as saturated fat, from ultra-processed foods or from animal foods, what happens is insulin cannot do its action. So going on a low carb diet is not the answer, because when you're still eating high protein animal foods and high fat, saturated fat foods, although your sugar levels won't rise because there is no glucose in that, you're making your insulin resistance worse. That's why we know losing a bit of weight actually helps with insulin resistance, but also changing the way you eat. So what we know is that polycystic ovary syndrome comes with metabolic symptoms of insulin resistance, resulting in excess weight, also, darkening of your skin called acanthosis nigricans, blood sugar issues, control, and things like that. It also comes with reproductive problems because it's the most common cause of infertility in women, the most common. And 1 in 10 women have polycystic ovary syndrome. But certain subgroups, those who are trying to conceive, those who carry excess weight, certain populations such as Asian and Hispanic groups, the risk may be as high as 1 in 4. But the sad news about this, Dave, is that 3/4 of women will never get a diagnosis. Why? Because there are other symptoms of PCOS such as anxiety, depression, OCD, increased risk of taking one's own life, as well as sleep issues, sleep disturbances, sleep apnea. So what happens is, if I have PCOS and I have irregular periods, I might go to see a gynecologist. If I'm having fertility issues, I might go to see a fertility specialist. If I'm having weight issues, I might go to see a dietitian. If I have anxiety or depression or OCD, I might go to see a psychiatrist. If I have binge eating disorder symptoms, I may go to see a therapist. If I have sleep issues, I might go to a sleep clinic. So what happens is, the poor person is caught in the middle and nobody's joining the dots. Nobody's asking all the relevant questions to say, you have a diagnosis of polycystic ovary syndrome. This is what you can do. Because without knowing what you have, it's very hard to treat any condition. So that is why one has to understand that this is the most common condition, most common endocrine disorder to affect women, but it has psychological issues that are manifested, metabolic problems, and reproductive health issues. And often half the women who are carrying excess weight, even if you are not, because 2 out of 10 women are not carrying excess weight, they're known as lean PCOS. Type 2 diabetes is a real problem by the age of 40. And then there are pregnancy issues. So even if you jump the hurdle of getting pregnant, you then are faced with increased risk of miscarriage, increased risk of pregnancy-related diabetes. You have increased risk of having premature labors and high blood pressure. So there are so much, it's so complex that the US spent $8 billion last year on pregnancy-related complications in those with PCOS and diabetic-related complications. And still we don't talk about it. Still, it's not a public health issue. Still, endometriosis is not a public health issue. Adenomyosis is the cousin of endometriosis, tends to affect, not always, but tends to be seen more often as women get older, so in their 40s, where you suddenly notice that over time your periods have got heavier, have got more painful when they actually shouldn't be that painful. So in that situation, you should, especially if you've had cesarean sections, because that can increase your risk of adenomyosis. It's a cousin of endometriosis. If somebody in the family has got endometriosis, that increases your risk. If somebody has a history, family history, or a personal history of endometriosis, that increases your risk. If you yourself have got, if you know that somebody in the family has got adenomyosis and had to have a hysterectomy because of that, that increases your risk. How you eat and your overall health also dictates as to whether you have these conditions. So
what's the distinction in those two, Dr. Nitu? What's the distinction between those two?
So endometriosis is outside adenomyosis. So it affects the outside. So it affects your ovaries, the back of your womb, the bowels. It is tissue that can be found in your lungs, in your nose. It's a very we don't know exactly why it occurs. It's not just menstrual blood coming and sticking itself out, but we do know that endometriosis is more modern. It's a more modern condition because women used to have about 10 or 15 periods in their lifetime. So your great-great-great-grandmother, because she was fortunate enough to survive, what would happen is she would have a baby at, say, 14 or 15 once she started her periods. She would then be breastfeeding or nursing for about 2-3 years. Then she would get pregnant again if she was lucky to be alive. So women would have 10-15 children if they were lucky to be alive, but most women died in childbirth. And by the time they reached 35-40, which was the average life expectancy, they would have had about a handful of periods, 10 periods. We women now would have between 350 to 500 periods in our lifetime. And that is to do with the fact that we are having 0, 1, 2, 3, 4 children at the most. And that does not mean to say that we should go and start getting pregnant when we don't want to, because pregnancy is a very dangerous business. So, but we have to understand that when you have all these numbers of periods, it increases our risk of various women's health conditions as well, especially anemia from heavy periods. 1 in 5 women are anemic from having heavy periods. And it shocks me every week. I'll see at least one person who's been investigated for everything except nobody's asked them about their periods. Okay, nobody. They're having iron transfusions, blood transfusions, they're having colonoscopies, they're having everything. Nobody's asked them what are their periods like. The most common cause of anemia is heavy periods. So ask yourself that question, make your doctor think about that question, because such good treatment is available for treatment of heavy periods. You don't, and your doctor doesn't have to decide for you whether you're any heavy periods or not. What you have to is, if you think you have heavy periods, though, that is considered heavy periods. That's important. That definition is very clear. So if you think you have heavy periods, your doctor can run some very simple tests of, checking your iron levels, checking your iron stores, and giving you the right advice. So much of information. I discuss a lot of this on my website, which has got about 40 different free fact sheets, maybe even 50, to try and educate people as to what is acceptable and what is not. Because if you don't know what is okay, like if you don't know what your body is meant to do, how are you going to tell people, or how are you going to know when things are not right? You know something is not right, but you don't know what it is.
But isn't it so crazy in the modern world, with so much information, that, as you said, periods aren't even regarded or questioned about at all, or to a minimum degree? It's such an important indicator of a female's body, what's going on inside the body, because it's such a big part of it.
Yeah. And periods should be, I have a whole section where I talk about periods being the fifth vital sign. Dave, I don't know if you know what vital signs are, but vital signs are, say, when you go into the hospital, the nurse or the doctor will check your temperature, your pulse, your respiratory rate, your blood pressure. And those are the 4 vital signs to see whether you're alive and breathing and things like that. Doesn't tell you everything, but they are the very important signs to say whether you're alive. But periods are the 5th vital sign. This is very clear from the Royal College, from the American College of Pediatrics and Obs and Gynae. Why? Because when you miss out on asking, it's not just about whether you're pregnant or not, because that is, now we have tried to bring that information out throughout, that any woman who walks through the door should have, in the reproductive age group, should have a pregnancy test, because sometimes they may be still having periods and are actually pregnant, and you can't operate on them. They may have an ectopic pregnancy and things like that. But what one has to understand is, you may have a broken leg and you are actually in the accident and emergency department, and if somebody doesn't ask you about your periods, they may not realize that you have osteoporosis from an eating disorder, for example, or you may have a chronic health condition, whatever it is. So there are so many reasons why period is a great indicator. If you're not on hormonal medication, periods on their own are a great indicator to tell you what your overall health is. Okay.
Your body talking to you again.
Yes.
That's your body.
And it's absolutely fine if you're on hormonal medication. You don't need to have a period, but that doesn't mean to say you shouldn't be aware of what your cycle lengths were before, what your periods were like before and afterwards. It's really important to know that. But absolutely, if you're on hormonal contraception, whether it's the coil, the hormone containing coil, or the pill, the progesterone only pill, the combined pill, you don't need to have a period. You can be going month by month and have no periods, and that's not going to do you any harm, because your body is giving you the right amount of hormones. But if you have an eating disorder, for example, what can happen is your estrogen levels drop and your bones can get very thinned out and things like that. A functional hypothalamic amenorrhea. There are so many conditions which we don't want to go into great details, but I hope your listeners have understood why periods are so important. What is a normal period? What is the length of a normal period? What is meant by endometriosis, adenomyosis, which is deep internal endometriosis. Endometriosis is outside endometriosis. Adenomyosis is deep internal endometriosis. What is polycystic ovary syndrome? But, it's a lot of information to take on. So what I would say to people is, go onto my website, read about the conditions that interest you, even if you're a man, because really I've had now so many men, Dave, reading the book, partners who are saying, oh my God. And my husband, throughout the book, he used to read the chapters, he would say, oh my God, I did not know this. Why was I not taught this in medical school?
Totally. Yeah. No, I think it's really important, like, for both sexes, because the thing is, it's like, even for me, as I said, my awareness of all of this has increased, my fascination in the last few years. And it's, being with partners who have actually suffered so much from, whether it be like that, they even have a coil or some form of contraception, but they're still going through immense pain, or pre-period and just bedridden and genuine immense pain for a week, and want to know, okay, Like if you have to get two people, one might know a lot, the other could know a bit more, and then you help each other. This is why
Correct.
it's important for both
Talking,
partners.
communication.
Exactly. Both partners become more and more educated in all these kind of areas. And this is why
And I think it also helps men to become more aware of their bodies, because men think that breast cancer, which of course is much more common in women, and 1 in 7 women in the UK, I don't know exact in Ireland, but 1 in 7 women in the UK, 1 in 8 in the US will get a diagnosis, sadly. But men get breast cancer too. And men have a high risk of prostate cancer. And while a lot of prostate cancer may not be very serious, it is cancer at the end of the day. And if you're a young person, getting a diagnosis like that is not fun, because you may need surgery and you can be left with impotence, incontinence, and things like that. And breast cancer risks and prostate cancer risks, like ovarian cancer and womb cancer and colon cancer, are all very closely linked to the 6 lifestyle pillars. So especially things like smoking, alcohol, and we know that consuming dairy, for example, increases the risk of aggressive prostate cancer by quite a significant percentage, while eating soya, which a lot of men are scared of, actually reduces your risk of prostate cancer. Lot of studies from the American Journal of Nutrition showing that prostate cancer, bowel cancer, liver cancer, ovarian cancer, womb cancer, breast cancer, all reduced when you regularly intake soya for women, and for men, prostate cancer as well.
Yeah, I think this is something that's really important. Like there's so much myths and misinformation out there, and definitely around soya. So clarify for
we
people.
have a whole chapter actually.
Yeah,
we have a whole chapter.
Brilliant.
Yes, and on my website, for those who don't want to buy the book, I have a whole fact sheet of the role of soya on men and women and on their health. So please read that, because there's so much misconceptions, so much misunderstanding. But I'm happy to bust some myths here.
Yeah, exactly. Like I think it's really important, because I hear this all the time, and it's clarify the actual reality around soya for both men and women.
Yes. So soya is basically, what is soy? Soya is a bean. Okay, just like your chickpea, just like your kidney bean, it's a bean. It comes under the group of legume, glycine max. Okay, it was first picked up grown in China, we think between 3,000 to 5,000 years ago. It is what I call a magic bean, because it is so rich in protein and fiber. It is got all the essential amino acids in the right proportion, like egg white, but without any of the nasties. Okay, so it's got fiber, it's got the right amounts of protein, it's got minerals, it's got micronutrients, vitamins. It's got all that. What it also has in addition, like chickpeas and kidney beans and all the other beans that you have, it has got something called isoflavones or phytoestrogens or plant estrogens. Plant estrogens are very weak estrogens that are very much, so these are very magic. Why are they so magic? Because they work on bones to increase bone strength. They work on the breast when you have low levels of estrogen to promote breast growth in puberty. But when you have high levels of estrogen coming in from excess body fat or from dairy and red meat and things like that, what it does is it competes for the same receptors, because it works only on the beta receptors. So it basically can either block the effect of estrogen or it can promote the effect of estrogen. That's what makes it so clever. Like chickpeas, like berries, like flaxseed powder, the lignans also have the similar action, but soya is queen. Soya is the Jack and the beanstalk, the magic beans. What it does, it really helps to reduce breast cancer, bowel cancer, because it's anti-angiogenetic, which basically means that it kills the cancer cells by working on the way the blood vessels work. It also helps to lower lipid profiles and cholesterol levels. Fermented tofu, fermented soy is really very good. So you want to have tempeh, tofu. So you want to have between 2 to 4 portions of soy. How much? And that depends on your activity. If you're a runner,
per week or per day?
Per day. So you would have a cup of soy milk and a handful of edamame beans. You would have, say, a handful of edamame beans and a handful of tofu or a tempeh burger. So between 2 to 4 portions. I eat about 4 portions of soy every day because if you're menopausal, if you have high levels of physical activity, you want to increase the levels of soy because you're eating more calories and things like that. If you're somebody who's otherwise just leading an ordinary life, then 2 portions as an adult. For a child, we would say about a portion. What is a portion? It's a handful. So a handful of edamame beans for a child is much smaller than your handful or my handful. So a handful is about 80 grams for an adult. So you would have a few pieces of tofu in your stir fry, you would have a tempeh burger, you would have a cup of soy milk and a cup of soy yogurt, or some edamame beans or mature soybeans. So you want to just have this. Why don't you want to eat 20, 30 portions? Well, first of all, we don't want to eat. If you just ate only apples, or if you just had a raw fruit diet, or if you just ate carrots, that's not a healthful diet. Okay, that's a restrictive diet. There is no restriction in a plant-based diet. In a whole food plant-based diet, there is no restriction because you're not restricting carbohydrates, proteins, or fats. Okay, it's just naturally low in fat. So avocados, nuts, seeds, and tofu and all have good fats in them. So that is why you want to bring soya into your life, but not eating 10, 15, 20 portions of soy, because then you're not going to eat your fruits, your vegetables. You want to eat between 10 and 13 portions of fruits and vegetables. What does that look like? It looks like 4 or 5 different fruits in a day. It looks like a big salad, or with all kinds of green leafy vegetables in it, and carrots and peppers and cucumbers. That will give you, because I remember 2 broccoli florets, large broccoli florets will be a portion for an adult, 2 or 3. So that's not a lot if you think about it. But you have to, what I tell my patients is, a lot of my patients come to me, they avoid fruit because they have this misconception that there is sugar in the fruit, and so they don't want to eat it. But I explain it's got fiber. Avoid the fruit juice. So I'll tell them, do you eat any fruit? No, I don't eat any fruit. Do you like any fruit? Oh, yes, I love grapes. Okay, will you eat grapes for the first week? A handful of them. Oh, yes, I can do that. Okay, I also like satsumas. Okay, the next week, will you add a couple of satsumas to your diet daily? Oh, yes, I can do that. Oh, I love mango, but I was told it's really bad for me. So suddenly they're eating 4 or 5 fruits over a period of a month or 2, without realizing it. Same thing with vegetables. Oh, I hate vegetables. My daughter doesn't like vegetables. Okay, does she like carrots? Oh, she likes carrots. Okay, she likes peas. So suddenly you're encouraging people to start where they are, not suddenly jumping to 10 portions of fruit and veg, actually teaching them where. Same thing with soy. Oh, I feel very worried about soy. Okay, so start with just having some soy milk in your porridge. Or why don't you just start with some edamame beans? Everybody loves edamame beans. Put a little cup out for your child, for yourself, drizzle it with some chili flakes or lemon, and pop them into your mouth like little popcorn. So it's just meeting people where they are. But soya is safe. If you have a thyroid condition, what we tell, if you're on thyroxine, for example, do make sure that you have enough iodine in your diet, because most people, we want people to cut down on their salt. But for example, I know in the UK, salt is not iodized. And so what you want to do is, unless you're somebody who's eating seaweed regularly and things like that, what I would recommend is taking 150 micrograms of iodine. And if you're on thyroxine, don't eat soya at the same time, because they both compete for the same receptor. So you just leave a couple of hours. So take your thyroxine maybe at night, and finish your meal, eat your meal in the circadian rhythm. So always try to say, I always tell people, don't do unnecessary fasting if you have conditions like polycystic ovary syndrome and things. You want to be physically active. When you finish your meal, you need at least 2-3 hours before you go to bed. Also try to go for a walk or do some stretches or something within half an hour of eating a meal, so that your blood sugar levels drop nicely and they don't you don't have those spikes. And that's for everybody, actually. It's not just for people with PCOS.
Lifestyle again, down to
it's lifestyle. So, and it's like a domino effect, Dave. So when you look at people's sleep, if you're having disturbed sleep, if you're somebody like me who does night shifts and things like that, when you have disturbed sleep, your cortisol levels go up. I suspect I went through early menopause or premature ovarian insufficiency at the age of 38. And even though I was a doctor, ready to become a consultant, I did not know any science about what was happening to me. I did not know where to turn for any holistic lifestyle approaches at all. I knew I should be taking HRT, but of course, this is 20 years ago, 22 years ago. So that was a time when there was a lot of misconception about hormone replacement. So even as doctors, we were confused. So what I'm trying to explain is that you want to be actually looking at every aspect of these 6 pillars. So if you don't sleep well, what happens is your cortisol levels rise. When your cortisol levels rise, the next lifestyle pillar, which is stress, gets your stress levels rise. When your stress levels rise, you reach out for foods that are not necessarily nourishing for you. When you eat those sort of foods, you feel sluggish and lack of energy, so you don't want to exercise. When you don't want to exercise, you then feel bad about yourself, so you don't want to go out and socialize with your friends or go, and laugh and be in part of a community. Then you might reach for the cigarette and the alcohol. Can you see it's like a domino effect?
Exactly.
So it's the same thing. When you reach and have a big, vibrant salad, you say, "Ooh, I've eaten really well. I'm going to go for a walk." When you go for a walk, I'll take a friend with me. So then you laugh. And so community. When you're in nature, then you're doing forest bathing. It's lovely. You're seeing trees and flowers, and it's all lovely. When you then go for a walk, what happens is your stress levels come down. You do some deep breathing. You then go to bed happier and sleeping better. So you then say, "Oh, you know what? I'm going to skip that glass of alcohol because alcohol is a class 1 carcinogen. It's implicated in 7 cancers, including breast cancer. Even drinking a single glass of wine, especially in the menopause, will increase our breast cancer risk by 12%. And for every 3 units that you drink, it increases it further." So there are
and that's really important, Dr. Nitu, in terms of just how big an impact even a small amount has, because society
there is no minimal amount of alcohol that is safe.
Because society makes out like it is. Like society will say, "Oh, look, it's only a drink." But
yes,
every little thing like that has a negative impact.
But what I would say to people is that be very mindful. If you are somebody who wants to have an alcoholic drink, then think and do it very intentionally. Do it because you're doing a celebrity toast, or you're sitting with company and you're having a drink. Don't binge drink. If you're going to drink, try to mix it with sparkling water, alternate it with non-alcoholic wines, because it's when you're in company, you will get that same high. You don't need to have a high with alcohol, and you don't need to be woken up or relaxed with alcohol, and you don't need to be woken up with lots of caffeine. You need to work out for yourself how much caffeine you can drink. And remember, in pregnancy, there is no safe limit of caffeine at all. It increases the risk of stillbirths and things. So it's really important to work out for yourself. Are you somebody who metabolizes caffeine very quickly? Are you somebody who actually has a low for days on end after alcohol? People don't realize how much their sleep is disturbed, So it's really useful. Go for a run. Things like that, which might actually bring you the same endorphins that, hug somebody, because you'll get oxytocin release. So I just want people to realize it's not that you have to completely give up everything. I just want you to be mindful and think, what can I do to make this life of mine better, healthier? And if you can't afford it, go to shops at the end of the day, go to the supermarket towards the end of the shopping day. The prices are brought down. Go to the local shops, go to the farmers market. You will get things for much cheaper, because I am very aware that not everybody can sit there and eat blueberries and flaxseed powder, but you can actually get these because fresh produce, especially, the prices come down. Buy beans that are dried rather than in cans, so that you can again buy in bulk. Go to the local Indian shop or the Middle Eastern shop, because you will get so much vibrant food and beans and potatoes and sweet potatoes, because these are all healthful foods. People who tell you that. So one trick about potatoes, because I know the Irish love their potatoes, and I am a great fan. I eat my body weight in potatoes every week. So always try to eat the potatoes with the skin. And try to double cook your potatoes. So not fried potatoes, but you want to boil them, mash them. You can roast them if you want to. But what you want to do is, when you cool them and you heat them again, then the resistant starch increases. So that makes it even more healthful. So you can alternate it between sweet potatoes with skin and potatoes with skin. You want to have things like nuts and seeds, lots of herbs on your, and start every meal with a salad. When you focus on whole food, plant-based foods, then if you occasionally treat yourself to a vegan pizza or to a piece of chocolate cake, or a piece of chicken or whatever, that if you're not somebody who's 100% plant-based, then keep those as treats rather than eating them because you think they're good for you. Because what is good for you, over and over again, the science has shown, is eating whole plant foods, legumes, beans, lentils, soya, whole grains, red rice, brown rice, wild rice, millet, amaranth, porridge oats, quinoa, fruits, vegetables. The global burden of disease study, which looked at 195 countries, I think, basically showed that, the doesn't matter what else you ate, but if you didn't eat enough fruits and vegetables, whole grains and legumes, you could prevent 11 million deaths. 11 million deaths. Yeah. So I hope I've given your audience enough information to go away, whether they were, whatever their gender. So yeah. I hope it's been helpful.
Because what's really important in your message is it's about taking small steps in the right direction. It's not about taking giant leaps or completely transforming your lifestyle, because as diets have proven for decades, they don't work. You have to make small steps in the right direction, and everyone can do it.
And you will fail. You will fail. Yeah. Every situation where you don't do it sustainably, when you don't do it in small increments, you will tend to fail. I'm not saying everybody, but that's what all the studies have shown. Majority of things, you will lose weight. You can lose weight on any diet, low carb, paleo, keto. You can, be on cocaine or smoke a lot, or on alcohol, whatever. You can lose weight in any of those ways. They are not healthful ways. Healthful way by eating more whole plant foods on your plate. Every time you load your plate, think, how can I bring more color onto it? How can I bring more vibrancy onto it? How can I bring more joy onto it? Because we are not isolated human beings. We are also living on a planet that is heading towards climate change. And one of the biggest things you as an individual can do is what you put into your mouth. So every time think, can I eat some more potatoes with baked beans instead of putting tuna on my baked potatoes? Can I have, porridge oats instead of or tofu scramble instead of an omelet? Little simple things like that. Make those little changes and you will be so surprised how much joy you will get. There is no restriction, how much vibrant you will feel. And you will also want to talk about it to everybody because you will be feeling this. I don't know of any patient of mine who has not actually benefited in this way. So, and I have a lot of recipes on my website. So anybody who doesn't know how to transition, both Rohini, my daughter, who's my co-author of the book, Living PCOS Free, her website and my website have lots of information, recipes that will hold your hand through to actually explain to you how you can eat, in a kind way that aligns with your body, with your morals, and with the rest of the world.
That's where, you provide so much information on your website and recipes and everything. It's great. And it's it's another myth that, being vegan or plant-based is just so boring and tasteless, when it's the complete opposite, because there are no rules. There's so many combinations and so many colors and tastes.
It's great if you can go vegan, but you don't have to be. Veganism is an ethical philosophy, and is great when you have a purpose as to why you're eating the way you're eating. But it is much more than that. It is actually, being kinder to the planet, kinder to the animal suffering, but also kind to yourself. Remember what we started the podcast with: self-care, self-love. When you eat these foods that reduce inflammation, you will improve your chances of being around for your family much longer, reduce your risk of heart disease, cancers, stroke, dementia. Dementia is the biggest killer for women in the UK. 18% of deaths is overtaken heart disease and cancer. That's how sad and scary it is. We're all living longer, but we need to live better. We don't want to spend the last 20, 25 years not recognizing our family, not recognizing our loved ones. We don't want to spend it in a hospice. We want to be around and die in our sleep like the blue zone people, in Japan and Italy and Greece and Loma Linda. So yeah,
it's like longevity, but with vitality. We want to have both. It's quality life that matters. So Dr. Nitu, that is an unbelievable amount of information you've managed to fit in. So your passion shines through. Tell people a little bit more about your book. I know we've touched on it a few times, where they can get it, any other key teachings or points you'd like to make about it.
Okay, so you can reach me either through my website. You can read about my information on my website, nitubajekal.com. And I'm also on social media, on TikTok, as well as on Instagram as Dr. Nitu Bajekal. Yes, I know, a 60-year-old on TikTok, but that's has to be done. The way it is. I have to share the knowledge. And we've just come out with our book, Living PCOS Free, Living Polycystic Ovary Syndrome Free, How to Regain Your Hormonal Health. As I said, this is not a book just for people with PCOS, living with PCOS. It's not just a book for women who are looking to regain their hormonal health, whether they have period issues, endometriosis, adenomyosis, fibroids. It's also for their partners. It's also for their loved ones. It's for anybody, because part one does a deep dive into period issues as well as the body, and then into polycystic ovary syndrome. Part two is all about informed health choices. And so informed health choices that look at sleep in detail, stress, look at plant-based nutrition completely, looks at alcohol, smoking, community, social network, exercise. So that is relevant for everybody. Then part three, it goes into individual symptoms: acne, excess hair growth, hair loss, excess weight. What can you do about excess weight? Racism in medicine. It's got every anxiety, depression. So again, relevant for everybody. You know, it's got a focus on PCOS, but relevant for everybody. And then the part four, and it's got a lot of myth busters and patient case studies as well. And it's all in blocks. So it's a big book, 470 pages, but it's got so many references. Everything is evidence-based. And it's got at least 33 recipes by my daughter, Rohini. A couple of them are mine, I think, have sneaked in. The tofu scramble, I think, is mine. And we have got a whole chapter on soya. We also have composite case studies, which means that patients of mine, I've used different names, different background, but they're all real patients and how they've been helped. And then there are PCOS pointers. So part one, well, actually all parts are relevant for everybody, but particularly if you want to know more about hormonal health, and even more particularly because I would say I wanted to write this book because I saw so many of my patients get better. I was writing a general book when Rohini, my daughter, who's herself living with PCOS and has got control of it, she's a nutritionist. She said to me, Mom, why are you writing a general book? You're going to be writing 3 pages on menopause, 3 pages on endometriosis, another few pages on polycystic ovary syndrome. You have 35 years of experience. Why don't you use that information to help people? So that's why I'm now on my path of writing. I don't know how many books. Already my second book on menopause. I've already done the outline, and as soon as I get a minute away from my garden and from summer, I shall start writing. But that's how polycystic ovary syndrome, because it's a condition that is stigmatized. It's a condition that people don't understand. So I felt I needed to start with this so that people actually are able to just go to a one-stop place. And we kept it without any colorful pictures. We kept it without any colored pages. We kept it without hardback so that it's accessible to everybody. And we're going into libraries to leave them copies or get them to order, so that if you can't afford it, you can read it even then. And the e-copy or the digital copy is actually much cheaper as well. But you can get this on Amazon, Book Depository, all over the world with free shipping, and any of the regular shops, Waterstones, W. Smith. Not sure Booktopia in Australia, but I'm not sure in Ireland who it is. But actually, my publisher lives in Ireland.
Yeah, to be in some of the stores for sure, and Amazon's always there anyway. So on Book Depository.
Yes.
But look, it's an amazing book. It's amazing to have something so focused and badly needed. Like we said, the stigma, the kind of taboo around it, and the lack of education.
Yes.
But like we started at the very start, it's all about lifestyle, and most conditions and diseases are lifestyle related. So
correct.
If we can make positive change in our lifestyles, then we can see improvement at the very
Absolutely. Least. It's not that you are going to be 100% better, but you will feel so much better than if you just did medication or, so that's important to know.
Yeah. Again, goes back to taking personal responsibility and
totally.
To being empowered by the fact you do have control over a lot of what's going on in your life and your body. So look, you're doing amazing work. Your passion shines through. And
thank you.
Just keep doing what you're doing, and you look amazing. To think you're 60 is unbelievable. You look amazing for 60.
In my head, I'm 30, so I don't care what the actual chronological age says.
Exactly, that's the way to be. Like I'm 44, I feel 21 in my head, so it's trying to keep that way.
Absolutely. My mother-in-law was 94, and she would let other women who are like 60s go ahead, and she said they need to take the wheelchair because I said, no, you're actually the oldest person here on the flight. It's all about attitude.
Again, attitude and mindset, it makes such a difference.
Totally.
And obviously there's a connection to ourselves then as well. But you're doing amazing work, great passion.
Thank you,
It's been
Dave.
a pleasure
Thank you for
to have you
inviting
on.
me.
Pleasure to have you on. I'm sure you've added so much value and knowledge to people now who hopefully will share that out there again. So guys, make sure you share this podcast out there. Make sure you check out Dr. Nitu's information. Order Living PCOS free, whether it's for yourself or for somebody else. Everyone needs to read this and they will get something from it. Check out the website for so much details. I'll include links to everything on the show notes, so just check them there. And as I said, share this episode out there far and wide, and keep taking positive action in your life. That's what we all can do every day. We have that power. Dr. Nitu, thank you so much. Have a wonderful day.
Thank you, Dave, and keep in touch.
Of course. Take care. Take care, everybody. Keep up the good work.
Bye now. Thank you again. Bye, everybody. Have a lovely weekend.
Talk to you in the next episode. Bye, guys.
Bye.